quadruped protraction, retraction of the scapulas. First, we get in the quadruped. So knees directly underneath hips, toes are relaxed. Press yourself off and away from the floor, pull the shoulder blades down, engage your core. I'm just going to go a little bit of an angle here. So you're making sure you're not letting your ribs hang out and your belly hang down. We have the hands pressed into the floor. It's almost like you're screwing your hands into the floor out. Okay, the fingers are going out, the elbows end up pointing forward, the inside of the elbows. You're going to press the shoulders away, engage, look a couple feet in front of you, pull the belly button and the ribs in to engage those lower abdominals. You're not rounding either. So we're finding that sweet neutral hip. All you're going to do here, keeping the lower back neutral, okay, by using those core muscles, gently contracting the glute muscles and the lower pelvic floor muscles at the same time. You're going to let your shoulder blades drop, so you're letting your chest drop to the floor, and then you're pressing up and rounding through the shoulder blades. So the shoulder blades come together, that's retraction, and then push apart, that's protraction. Keeping your arms nice and straight. Your elbows are not moving in a push-up motion. You're just moving those shoulder blades. Getting those shoulder blades some love is going to help give some mobility and some blood flow into those areas where we get restricted and tight from most of our postural movements all day. That's progression 1. Progression 2 from that is good old floating quadruped on your knees, make that core work, same exact movements, protraction and retraction. I'm already sweating just by having to engage the core a little bit more on those toes, keeping that lower back nice and neutral. It should not be moving. If you can't do the knees floating without the lower back kicking in, then we're just not ready for that, and that's absolutely fine. Pay attention to those shoulder blades. We want nice, easy flow and movement of those shoulder blades. If you're feeling like a cracking and a ripping, that fascia needs to be worked a little bit more. And you definitely need to be doing that thoracic mobility video that I have in the 12-week program. But you're going to superset this quadruped protraction retraction with a TheraBand lat pull. So we're in a prone position. If you tend to feel uncomfortable laying on the floor, we can put a little bit of a pillow or a prop underneath us. Okay, nothing too big, just enough so that you are engaging the pelvic floor and the lower abdominals and the hips into the floor. Okay, so we're going to come here. You're going to pull the band apart. Okay, inhale, and we're going to pull as you inhale. Okay, pull the band apart. Hold up here at the top. Engage the lats down, so you're pulling the band in front of your body. Your elbows are coming down like you're doing a pull-up. Right, you're pulling up a little bit more, and then back down. That's the movement. We're going to add the breath. So you're going to inhale to prepare. Flex the glutes, pull the lower abs in. Exhale, lift up. Inhale, pull and lift a little bit further. Exhale, stay holding, and then back down. So it's inhale, exhale, lift. Inhale, lift further. Exhale, lift and pull even further, and then inhale back down. That's 3 repetitions. So doing 8 to 10 of those, alternating it or supersetting it with the quadruped protraction retraction.